係咪？sorry 呢邊啊。歡迎各。
Welcome to the press briefing on COVID-19. Today we have Professor Sophia Chan, Secretary for Food and Health, Mr. Howard Chen, Deputy Secretary for Food and Health, Dr. Chuang Shuk Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Kah-hin, Hospital Authority Chief Manager Quality and Standards. Professor Chen will first tell you about the latest epidemic measures, and Dr. Chuang will give you an update on COVID-19 cases. So Professor Chen first. Thank you. Friends of the media, good afternoon. In our response to the COVID-19 epidemic, we have always held fast to three principles: that is a swift response, high-level preparedness, and high-level transparency. And we have three strategies. The first one is on arrival control. So at the boundary crossing, and boundary control points. So we want to prevent imported cases by controlling arrivals. And then second is a containment strategy. That is, we step up our testing capacity and surveillance, and also we step up tracing of cases and close contacts. There are also quarantine and isolation arrangements in place. The third strategy is social distancing measures to minimize gatherings and the risk of community outbreak. In the past few weeks, the epidemic has more or less stabilized. We have sporadic imported cases, but unfortunately, in recent days, we have seen cases in the community with unknown sources of infection. For example, 2 weeks ago, we had the Lemok Shu estate cluster, and then recently at Nik Yuen estate, we have a cluster of related cases with unknown sources of infection, so we must not let down our guard. This morning, in relation to CAP 599, the Executive Council made a series of decisions on the various regulations under the ordinance. So I will now give you the latest arrangement. In terms of policy, the World Health Organization and experts have all indicated that for COVID-19 epidemic, or for COVID-19, before we have any effective treatment or vaccine, this disease is not going to go away. That's why different places and countries will have regard to their own situation and their economic needs and make appropriate measures. And also, there's need to adjust the strengths of various infection control measures in the light of circumstances. Now, our goal is, we have already, of course, been working hard to prevent and control the epidemic. We know this disease is still with us. So maybe the objective is not to totally eradicate the disease or to achieve prolonged period of zero infection, but rather, perhaps, it's about how we manage the epidemic and control measures, and then we will make this part of our day-to-day task. So this is what we're doing now. In the near future, we expect that there will still be sporadic local cases or even mini outbreaks. Of course, we will continue to monitor the situation closely. In the light of the development of the epidemic, we will continue to adopt our. Specifically, we will try to balance different considerations such as public health, protection, economic needs, social needs, and so on. So on the one hand, we need to maintain the various prevention and control measures. On the other, we need to allow room for normal activities to resume in the community. First, on reducing social contact and the relevant measures. In this respect, we have considered the latest development of the COVID-19 epidemic and our suppress and lift strategy. We believe we need to maintain CAP 599, the measures under CAP 599F, that is Prevention and Control of Disease Requirements and Directions, Business and Premises Regulation, and also CAP 599G, Prevention and Control of Disease Prohibition of Group Gathering Regulation. We believe we need to maintain these measures to restrict gatherings and so on. So we're going to amend the two regulations and extend the validity period for another 2 months to the 30th of August this year. We must stress again that in line with usual practice, we will be reviewing the latest situation from time to time, and then we will make new directions by Gazetto, and then the directions will not be more valid for more than 14 days each time. Now, in the light of the latest cluster, we believe there is a need to maintain the current restrictions in relation to business premises such as eating establishments, and also we need to maintain the gathering restrictions for another 14 days. That means starting from this Friday, the 5th of June, to the 18th of June 2020. So that will be the next 14-day period. And then we'll have regard to the latest development of epidemic and review the measures. If necessary, we may tighten the measures and we'll make timely announcement on the arrangements after the 18th of June. For border control measures, given the external environment starting to stabilize, especially on the mainland, and for certain countries that is the case. So we will always have regard first and foremost to public health, and then we will now make plans to reopen some of the boundary control points and some other work, in relation to other places. Now, on relaxing boundary control measures or travel restrictions, we need to consider various factors in depth. We also have to have regard to the epidemiological situation in the various destinations. We have to look at their surveillance system and the testing capacity for the disease. Now, different countries and different places have different circumstances, so we need to set up a mechanism. And then we'll have to consider each country or each region on their own. And then we'll look at the risk levels, and then we will give a grade. And then for different countries and places, then we will gradually relax border control measures or travel restrictions as appropriate. Under the current legal framework, there are, for people arriving at Hong Kong under CAP 599C and CAP 599E, that is for people arriving from certain destinations and from foreign places. Now, if they've been to the mainland or designated places outside of mainland 14 days before they come to Hong Kong, apart from the exempted persons, regardless of their nationalities or the travel documents they hold, they are all subject to 14 days of mandatory quarantine. The relevant measures will expire on the 7th and the 18th of June, respectively. Now, because the global pandemic remains in a state of flux, so we still need to restrict people movement between Hong Kong and certain places, and we need to put in place certain quarantine measures to prevent imported cases. At the same time, we believe there is need to introduce a mechanism so that when we assess the relevant public health considerations, then we may relax the mandatory quarantine requirement for persons coming from certain places or countries. And then between certain places and countries and Hong Kong, we are able to resume people movement and stimulate the economy. So in this respect, the government will be amending CAP 599C and 599E. The Secretary for Food and Health will be empowered to designate two categories of places from which people may arrive. First place is that if they arrive from designated places, certain people would have to go into mandatory quarantine. That is the current arrangement. The second category is if people come from the category 2 of designated places, then if they meet certain conditions, then they could be exempted from the mandatory quarantine arrangements. Now, for these two categories of places on the mainland or outside the mainland that will equally apply. So it would be either under 599C or 599E, and then we'll be amending these two regulations to introduce this mechanism. At the same time, we're going to expand the powers of the Chief Secretary for Administration under 599E to exempt certain people from undergoing mandatory quarantine. This will cover people who would benefit the economic development of Hong Kong, and so this is to do with 599E, and so we will bring people under 599C and E on a par. And at the same time, we must still restrict movement, people movement between Hong Kong and certain places, and we may still need to impose mandatory quarantine measures. So for places on the mainland and outside the mainland, we must still monitor closely the development of the epidemic. For 599C, we're going to extend the validity period for another month till the 7th of July 2020. And then for 599E, we'll extend the validity period by 3 months to the 18th of September 2020. Now, for the relevant legislative amendments, they will be gazetted later today, and then this Friday, that is the 5th of June, they will come into effect. Now, this amendment is to provide a legal basis, and then in the light of the latest epidemic developments in other countries or places on the mainland, we can then assess the latest public health risks, and we could then designate places accordingly. That is Category 1 or Category 2, as I mentioned. Now, we will continue our discussion with the relevant authorities on the mainland and in Macau. So under the Joint Prevention Control Mechanism, then we will maintain close communication. Now, it seems that for the time being, there may be limited relaxation among Guangdong, Macau, and Hong Kong. For those who who have essential needs to travel among the three places, they will be the first group to be covered. Now, when the arrangement is in place, the government will make the announcement. And perhaps I could also say a few words on enhanced surveillance. Now, for laboratory surveillance and testing of the virus, this is part and parcel of the government's effort to fight the epidemic. It's a key element, actually. Now, for people with symptoms or with mild symptoms, they could be tested. There are also asymptomatic patients who have been who've tested positive. So it's important that we identify these people as early as possible, so we could then isolate them and treat them accordingly. Now, the recent cluster has caused concern because there was a patient who went to see a doctor, but then she didn't leave a specimen for testing COVID-19. We've seen a case like that. So here I would like to appeal again to all private practitioners to fight this epidemic together with us. If you find that a patient shows respiratory infection symptoms, or even if the symptoms are mild, or if there are any suspicions, then the doctor must arrange for the patient to undergo the COVID-19 test. Actually, in Hong Kong, we have 7,000 private practitioners. When people feel unwell, many of them would go to see a doctor. They are the first point of contact. So they are partners in our public health system. They are also the first line of defense. So the involvement of private doctors in the scheme is important. And then because it will help for early identification of patients, it will substantially help us to expand the scope of our surveillance network. I understand Dr. Chuang Chok Kwan, the Center for Health Protection, have written to all doctors in Hong Kong again yesterday and remind them of this. For the public systems testing capacity, now we keep enhancing our testing capacity outside of hospitals. We've expanded the scope of surveillance to cover the community, and we have concrete measures as follows. Since the beginning of the epidemic, from hospitals, we've expanded our testing scheme to cover hospitals, and then community, covering the public health sector, and then further on to private practitioners Later on, we expanded the surveillance scheme to cover those working at the airport, and now we've extended the scheme to cover persons with no symptoms. So we have been increasing our surveillance capacity and the laboratory testing capacity on an ongoing basis. Starting from the 15th of May, the Department of Health has started testing for workers at the airport. They have given out 1,700 specimen bottles, and they've received about 70% of the samples, and then they all tested negative. And then for people coming back to Hong Kong, they are tested, of course, and then even for transit passengers, they are the high-risk groups as arrival. So therefore, the people working at the airport are considered a high-risk group. I appeal to them to take the test. The Department of Health has already kept specimen bottles at the airport for the workers there. And I would encourage employers at the airport to encourage their employees to take the test. Starting from the 20th of May, for homes for the elderly, the disabled, and so on, the Department of Health has given out 3,200 specimen bottles. We have received about 40% of the samples, and they all tested negative. So again, we appeal to those who've been given the bottles to return the bottles as soon as possible. And then starting from the 23rd of May, the DEH started a pilot scheme at a Chinese medicine clinic. Specimen bottles are now provided to people going there. Maybe for people who are in contact with a large number of members of the public, like drivers or frontline workers of public transport operators, cashiers, those in customer service or those in hospitality service sites, hotel workers, cleaning workers, beauticians, trainers, and those frontline workers at entertainment venues. I hope they will take the test. And then together with the Kwai Ching District Health Center, the Department of Health has started a pilot scheme. So at the Kwai Ching District Health Center, we are distributing specimen bottles to the groups I mentioned. That is, people who may come into contact with more people in the line of work. So we would like to enhance community surveillance in this manner. And then the hospital authority has also enhanced and expanded their laboratory surveillance program. For people, for inpatients with symptoms of the flu, they are tested. And then for patients staying at mental wards, there's also testing by samples. And where they're doing sampling tests. And then they started since the 20th of May. So far, they have already tested 2,300 samples. They all tested negative. Now, all these are about the testing capacity in the public sector. For the private sector, the Food and Health Bureau and the Department of Health have been meeting with many private laboratories. We've been encouraging the laboratories to provide the COVID-19 tests. And we have given them assistance. For example, quality assurance scheme. And then for laboratories that plan to do the test, we have given them some free test samples. And we've also provided them with the testing standards. Now, this is important because for many of the private laboratories, the tests they provide must meet a certain standards. We will continue to work to liaise closely with private laboratories and make sure that their tests meet the reference standards. And on that basis, we encourage the private sector to enhance their testing capacity too. And I must stress that testing plays an important role medically. It will allow us to identify infected persons at an early stage, including many who are asymptomatic. And then we could, have early isolation and treatment. Also, it is very important in the monitoring and control of the epidemic. In fact, it is key. So I must again, if you have any reference symptoms like a fever or other upper respiratory tract symptoms, even though if the symptoms are mild, please seek medical treatment as soon as possible, and please get a test as soon as possible. You could actually ask for a test yourself. And then we'll see what the doctor has to say. The doctors will refer to their professional judgment, and then they may decide a COVID-19 test is necessary. As for private doctors, of course, I already reminded them just now that they must remain vigilant. If there are people seeking treatment with relevant symptoms, they should arrange a test for these patients. Now, the global pandemic remains in a state of flux. Especially in South America, we are seeing a problem there. And in Asia, in the past week or two, we have seen cases picking up again. So therefore, in Hong Kong, it is important that we maintain our prevention control measures. We have to closely monitor the situation locally. We also need to pay attention to the developments outside of Hong Kong. So I would like to appeal to the public on two fronts. Firstly, please remain patient. Please support various measures that on the personal level, wear a mask, wash your hands, observe environmental hygiene, personal hygiene. That's important. That's on another front. If you don't feel well, even if the symptoms are mild, please go and seek medical treatment and ask for a test. This is also very important in our overall effort to control the epidemic. Now I'll invite Dr. Cheong Kwok Kwan to give you an update on COVID-19 cases. And then Dr. Lau will also give you an update about the hospital authority. Thank you.
Ladies and gentlemen, from last night to now, there have been 6 confirmed cases, 4 locally, 2 imported cases. For the 4 local cases, all of them are residents of Luk Chun House of Lek Yuen Estate. We have the 10A4, 10A5, and we have distributed the sample bottles to residents of Luk Chun House for them to leave their throat samples. 4 of them were confirmed last night, and they're namely 1089, 1090, 1091, 1092. 1089, she's a female, 68 years old. She's living with her daughter, daughter-in-law, and grandchild. She's basically looking after the grandchild at home, but she would go to Wo Che or Lek Yuen to do shopping. She doesn't have any other activities normally. On the 29th of May, she suffered from mild cough. 1st of June, some mild headaches. She didn't go to the doctor on the 1st of June. Well, on the 1st of June, she left the throat samples with us, and it tested positive. 1090, 57-year-old female. She's staying at home with the domestic helper. She didn't develop any symptoms. Normally, she would stay at home during the afternoon. She would go to Lek Yuen, Sha Tin market, shopping. Earlier, there were some relatives visiting her, and that was back in the 23rd of May. She didn't have any travel history. 1091 is a 56-year-old female. She's retiree. She's living with her mother and a sister. On the 30th of May, she developed some cough and some a bit of fever. On the 1st of June, she left the throat sampled with us. Normally, during the incubation period, she would go to the Lucky Plaza and Waiwa Center supermarket. She's been to some of the eateries, some of the eateries in the Wo Che estate. Other than that, she didn't have much other activities. So the 1st of June, she visited a pharmacy in Lucky Plaza. 1092, 78-year-old female. She's living with her son, asymptomatic. Every morning, she would go to Sha Tin Park for morning walk. She would go to Sha Tin Market and also the Lucky Plaza, the supermarket there, and also the supermarket at Lake Yuen Estate. She didn't have many activities other than going for a morning walk and the market. The two are asymptomatic. Two had minor symptoms. They were admitted to hospital. According to the hospital authority, they developed some fever. There were some symptoms that they were not aware of. 1093 and 94 are related cases. 1093, 15-year-old male. He's a family member of 1055, 1063. In May, they visited Pakistan, and on the 16th of May, they came back on QL 818. His mother and sister, or younger sister, and paternal grandmother, 1063, are confirmed cases. He didn't have any symptom. 1063 was confirmed, and the quarantine period was extended. Just before he left the quarantine center, he tested positive, although he was asymptomatic. 1094, a 42-year-old female. Now for 1063, when she came back to Hong Kong because of a health condition, she's living in Tuen Mun. She never visited Pakistan. But because of the health condition of 1063, she went to the quarantine center to look after her. 1063 was confirmed, and she stayed in the quarantine center for isolation. And by the 12th day, she left the throat sample, which tested positive, although she was asymptomatic. It was because of the need to look after 1063 that she got infected. Now let me bring up to date on the specimen bottle for Lake Yuen Estate. Lok Chun House, there are 1,200 or so residents living there. We have collected about 1,000 bottles. We've tested 700 or so, and 4 tested positive. At Luen Yuen House at Kwai Luen Estate, there are 2,000 or so residents. We have collected 1,600 specimen bottles. 400 of them have tested negative. For the other places that I mentioned, those after 1086, they've been to the markets, banks, cafes, or supermarkets. And these are not close contacts. However, we'd like to identify whether there is any silent chain of transmission. So we have distributed the deep throat saliva bottles to them because they mentioned that they've been to pharmacies and supermarkets. So we have distributed bottles to these people working there. Dr. Lau, at Asset Loan today, over the past 24 years, we have submitted 17 cases to the at the DH. We have altogether 72 patients who are still hospitalized for isolation and treatment. Over the past 24 hours, we have one recovered patient, 1045, patient 1045. There have been 1037 confirmed cases and 1 suspected cases that have been discharged. As of noon, excluding the 2 imported cases, we have 50 confirmed cases, scattered in 9 different hospitals. 2 are in critical condition. In PYNEH, patient 595, and PWH 1084. All the others are in stable condition. As at 9 a.m. today, I've opened 1,200 negative pressure ward, and we have 650 beds. Utilization is 59%. Right, and I'll throw the floor open for questions. Please identify yourself and the organization you work with. Please limit yourself to 3 questions at one time. The lady over there, please.
RTHK. First, as Secretary, can you clarify to all of us about the 599G and 599F extension? Is it currently only extended to June the 18th and not till August the 31st? Because people around the internet are accusing the government of extending it for more than 2 months. And also, critics have also accused the government of extending these bans to cover many of the anniversary dates of last year's protests. They accuse you guys of doing that so that Hong Kong citizens can't express discontent, particularly towards the national security laws. So how will you respond to that? And at the same time, why hasn't the government reviewed some of the current measures, such as class resumption? And then question about for Dr. Chung, perhaps. Have you guys collected all the environmental samples? And judging from those samples, where has the infection actually taken place? Is it, as Dr. Yun Kwok Yung said, has taken place at some of the lifts or at some of the mailboxes, etc.? And why not put people in that building under medical surveillance or even quarantine? And would authorities also consider testing people in that whole estate for the coronavirus? Thank you.
Okay, thank you for your question. First of all, let me clarify. The strategy of our current measures is obviously suppress and lift. So in reviewing the local situation and also the global situation of the pandemic, we will make different strategies and also to adjust the different measures. Now, if you can see from our previous adjustments, or you can say lifting or relaxation, it is always with some conditions. But then, as you can see, just most recently, we have a local cluster develop, and we actually are very, very concerned about this local cluster, because it appears that we have this local cluster after about 15 days of no local cases. So therefore, we basically, if you talk about the 599G and also 599F, well, we are now keeping it as status quo. So that is, for those measures that we have put in place under the 599G and 599F, we will keep it for another 14 days. Just now when I said so until 14 days, and that means the dates would be the expiry date plus 14 days. And the 31st of August is really the, if you remember, when we first come up with this legislation, there is a timeline of like 3 months. And then as far as the legislation is concerned, we would have to extend it to provide a legal framework so that we can put in directions and we can put in the different conditions for different premises, as well as the prohibition of gathering to follow. So that is to provide a legal framework for the legislation as a whole. But as far as the directions, the conditions is concerned, it is for 14 days.
Some of the accusations regarding covering most of the protests, are you guys trying to press down people's chance to express discontent towards national security laws? And why not review class resumption positions?
I think, well, what we are doing and what I have proposed and what has been discussed in the EXCO this morning in terms of the legislation and also the different extension is really based on public health grounds. So as you can see from the local cluster that have been developed, developed 2 days ago. So that was something that is not planned. But then we have to deal with it in terms of being a public health responsible, public health department. So therefore, we are looking into and considering the different factors based on public health and not other considerations.
We have tested the toilet. We have tested the toilets of the 4 new cases. We have taken some environmental samples from the drainage surface and the vent pipes, and so all the test results come back to be negative. So as Professor Yuen has explained last night, no architectural defect has been observed that can explain the transmission among these few cases. So there's no recommendation to evacuate the building because we have not found any architectural defects. So we'll try to chase the results. We want to appeal all the residents of this building to hand in the specimens, if not already hand in, and we'll try to chase the results of all these residents to ascertain if there are other cases in the building. So we'll also appeal all the residents in the estate, if they have any mild symptoms, try to go to see doctor as soon as possible and obtain a salivary specimen to test if you have any symptoms.
But why not put them under medical surveillance or?
So we are testing all the residents in the building. So we'll ask them to observe their symptoms, even if you are tested negative in the first test, you still have to observe your symptoms. Yeah.
好，下一條，嗰邊第二。
Next, please, on the second row, the gentleman there. I'm from Hong Kong 01. Mr. Howard Chen, when would the health code system be introduced, and what would the validity be rate? Is it 7 days? And would the privacy of Hong Kong residents be breached? Would there have to be agreements on one of 3 places before you can put that in place? And second question about Lake Yuen Estate, have things gone out of control? Is there an outbreak? Now, with the current hospital resources, can you take care of all the patients? For Lok Chun House, within 10-minute walking distance, there are 6 schools. So would you wait till the situation stabilizes to allow classes to resume there? And then you say you will extend 599 F and G to the 31st of August. Now, are you extending the gathering ban to stop people from protesting in the light of the various anniversaries, like the 21st of July, 31st of August, or whatever? Now, you talk about the health code system. I think Mr. Chan could answer in a moment. For Guangdong, Macau, and Hong Kong, we have a joint prevention and control mechanism, and we're now in discussion. If the epidemic has stabilized, then we'll see how we could have mutual recognition of each other's epidemic measures, testing measures, or we can also see whether we could have mutual recognition of laboratories and which laboratories. Now, with the Guangdong and the Macau authorities, we are now in discussion on the health code, what Mr. Chen could say a bit more later. Actually, for Hong Kong, we are now working on a health code system. Mr. Chen, please. Yes, for the 3 places, we have this joint prevention and control mechanism. So within that framework, we are discussing whether we could gradually relax the flow of people among the 3 places. Maybe if travelers have undergone tests, then with this test results that remain valid, then there could be mutual exemption of the 14-day mandatory quarantine requirement. Well, we're still in discussion. Of course, the guiding principle is that we will protect the privacy of individual travelers. So information will not be exchanged. In other words, but we have different testing systems and quarantine systems, so it's a matter of a mutual recognition of each other's testing results or quarantine arrangement. So it's against that principle, and it's about protecting privacy, and then we will have, do that with recognition of information rather than exchange of information. We're still working on the details, and when we have made any decisions, we will announce them. Let me talk about 599F and 599G again, and Dr. Chuang could talk about Lake Yuen Estate. For both 599F and 599G, we're extending the two regulations, and then we have also issued certain directions under these two regulations. We're extending those directions as well. This is all based on public health considerations. And of course, recently we've seen a mini outbreak of a local cluster. We are very much concerned about the outbreak, and also when we look at social distancing measures, we have to consider the current state of the epidemic. So these are purely public health considerations. There are no other considerations. Let me explain again. For the 31st of August, that is the extension date for the entire legal framework. You might recall the regulations were first valid for 3 months, and of course we could extend it by a month or 2 months, and these are emergency regulations. But we believe 2 months would be about right. And within these 2 months, it doesn't mean, though, that we can't do nothing in the interim. That's not the case. Now, I have made various directions, and then with certain premises, as you might recall, like eating establishments or even for the gathering restrictions and so on. All these measures are valid each time for a maximum of 14 days. Now, but then for the two regulations, they are to expire. That's why we need to extend them to the 31st of August. Otherwise, we don't need to worry about that. And then for the measures or the directions, we'll see whether they will be extended by 7 days or 14 days on each occasion. And then we're talking about the regulation under the 599G and F. We're extending certain directions by another 14 days. That's what I'm saying now. Dr. Chuang? Well, for Lake Yuen Estate, there are 6 cases. 2 cases are a couple. And for the other 4 cases, we believe the transmission is because of contamination of the environment. We are still trying to see whether there are other cases in the same block. So that's why we hope all residents would return the specimen bottles to us as soon as possible. And then we could find out about the test results, and then we'll have a better idea of the scale of the outbreak. But for the time being, we're not seeing any other situation in the community. For these 6 cases, they are all confirmed cases. They've all, spent time in the community. So at places where they've been or along the route, we are trying to do more tests and try to reach out to more people that may have been in contact. And even though these people may not have been in contact, we want to do more tests so we can have a better idea about the situation in the area.
呢個都係一啲
There's a hypothesis. We understand that the virus will stay in the environment for some time. We are trying to get hold of these 4 people and the other 2 people to see whether they've been to any common places. Maybe there are some lives that they shared. Maybe they would touch certain places at the exit. They're not living on the same floor, and they're not living in the same vertical units. So there are some chances that they may share some lifts, or maybe they share the exit, where they are likely to get infected. When we became aware of the first 2 cases, the housing department has already disinfected the places. In particular, the common areas, and disinfection has taken place. We didn't collect these samples because we are convinced that they would turn out to be negative. So we took samples from the toilets, from the pipes, and these 4 flats have not been disinfected. We believe that we will stand a pretty good chance of identifying some virus, and we test positive. The gentleman in stripes, commercial radio. Professor Chen, now for the group gathering ban is going to be extended. There are some experts who suggest that we can relax the number, or we can make a distinction between indoor and outdoor. Now, indoors, we're all wearing masks, and the ban may not be effective. Now we have the swimming pool and the open, and there are people gathering. Now we have this national security law that is very controversial, and people would lose the chance of staging a rally and staging a protest. In a way, is this measure depriving people of the right to have rallies and protests? Also, the stepped up testing, if I may put this to Dr. Chuang. There are some health experts who said that they've been to Lucky Plaza, they've been to a Welcome supermarket. Isn't it a good idea for you to set up some booths there to collect samples in order to boost the testing? If this is not achievable, why is that? What are the constraints? Thank you very much for your question. Now for 599F and also 599G, as you referred to a moment ago, we apply the 14 days, and we are keeping the situation under a regular review to gauge the pandemic situation to see whether there is room for relaxation. As I said a moment ago, we are adopting this suppress and lift strategy. At the very beginning, we started off with 4 people, and this was relaxed to 8 people. In recent times, we have seen a local cluster. So we are deeply concerned about the situation. From the public health point of view, we don't believe that this is the right time for us to relax the number any further. So we'll keep the situation under review for 14 more days, and we will consider the situation as we go forward. I must reiterate that this is extended to the 31st of August because under 599F and 599G, on the 27th of June and 28th of June, they come to an end. So we have to have this extension. But for 599F and G, for these regulation, it is our proposal to extend for a fortnight. Given the situation of the virus, and the WHO and many other experts have said that until we have the vaccine, the virus is likely to coexist with us continuously. So we have to accept this new normal. By this new normal, it doesn't mean that we are going to deprive people of the freedom of expression. Under this new normal, we have to make some changes. We didn't used to wear face masks, and now we do. We didn't used to use visual tools to get a message across and to get our work done. Now we are resorting to digital means more often than we have been. So I hope that you will understand our starting point is the public health. And I hope that we would identify new ways for communication and for expression of our views. We step up the testing as part of the means of epidemiological control, because we are getting in touch with the context. We hope that we can identify certain people for testing. Maybe someone has been to a cafe and the staff members have been exposed to the confirmed cases. If we set up a booth and blindly test the people that may or may not be positive, it will be like looking for a needle in a haystack. It would be hard for us to identify the right person. Now, for people like Professor said, for those with even minor symptoms, they should seek medical attention, whether they are in that particular district. If they suffer from even minor symptoms, they should seek medical attention. We are stepping up the test to cover the identified people, like the restaurant. We like to identify the targets. I mean, we're not doing this just on the street because it would be very untargeted. Can you make a distinction between indoors and outdoors? Now, even for karaoke, it is an extension of 7 days. Well, the observation period, as you heard from Dr. Chuang, we have this local cluster. We have distributed a lot of sample bottles. For the first round, we have picked up 4 confirmed cases. There are some samples that remain untested, and some of them have not been forthcoming yet. So the contact tracing is still going on. I think we need a bit of time to look at the situation, to have regard to the data. In order to go in depth into this cluster, 7 days would be too short, because we'll have to go back to the EXCO very quickly. We have just identified this local cluster. It may not allow us enough time to get a deeper understanding of this local cluster, so we have set 14 days. By the time the situation becomes clear, we do not rule out the possibility that within the next fortnight we will revisit the situation. But at the beginning, at the preliminary stage, we feel that 14 days would be about right. Indoors or outdoors, we do not make a distinction like this. From a public health point of view, we will look at the number of group gathering, and this is going to be very important. As we said many times, if we want to break the chain of transmission, we need to have social distancing, because there is the droplet transmission. We need to maintain 1.5 meters of physical distancing, because without this distancing, there is a risk of transmission. So whether it is indoors or outdoors, these risks would still persist. You may then ask, why do we allow people to eat together? It all depends on the necessity. If there are some premises, if there are some eateries where we need to visit, then the suppress and lift strategy would apply. We need to relax the requirement at certain times, and to what extent should we relax the requirements? All these are done in the light of effective social distancing and public health, and also to minimize the transmission risks.
Next, on the third row to the far right, the gentleman there in blue T-shirt. I'm from the Stand News. First question is about indoor and outdoor. Now, Dr. Ho Pak Leung said if it's outdoor, as long as people wear a mask, it's fine, even if there is no gathering restriction. Now, the Secretary said many times the government looks at public health considerations. Well, Dr. Ho Pak Leung is an expert on public health. Would you not consider his advice? Is it that the public health considerations you have would exclude advice from experts like Dr. Ho? That's the first question. Second question. Now, the Secretary said because there are local cases, so you're not going to relax the restrictions. But then you said that also that you expect to see sporadic local cases from time to time. So does it mean that as long as there are sporadic local cases, you're not going to relax all the restrictions? So that means there will be gathering restrictions forever? As for 599 CE, F and G, well, perhaps you explain it really in a complicated manner about policy issues. Can Howard explain the 4 regulations to us? Perhaps it will be easier for us to follow. Now, let me stress again on public health considerations. Of course, we'll listen to the views of experts. First of all, we will look at data. For example, the number of local cases, the sources of infection for local cases, the nature of cases, and so on. For example, like the local cases this time round, we're not just talking about 1 or 2 isolated cases, but rather we can see that from the 2 local cases, we have seen other cases in the same block where the patients live, and in the workplace where the patients work. So we've also seen certain cases. That's why we need to do more investigation, and with distributed specimen bottles, we'll have to see how the test results turn out, and then we will can confirm or decide whether there will be an outbreak or there are other infection cases. So that's why this is important. And we have to look at scientific data. At the same time, of course, we'll listen to the advice of experts. Now, the Center for Health Protection and the Department of Health are doing risk assessment every day. And this is, of course, also important. And second point is about local cases. As I said earlier, we may have sporadic local cases. Where they are sporadic cases, then it's a different scenario. But then some local cases may lead to an outbreak, primary, secondary, or tertiary infection. And again, this is a different scenario. And then there may be local cases that may lead to many other infection cases locally. So it depends on whether sporadic local cases would lead to other outbreaks. So we need to do in-depth investigation. We have to find out the nature of these cases. So it's not necessarily the case that just because we have local cases, then we can't do nothing. But then just over 2 weeks ago, we had local cases at Lei Mok Shue Estate. We have tested over 2,000 samples. They all tested negative. So really, we have to see what the situation is, and considering our suppress and live strategy. Now, in this case, we have distributed specimen bottles, and then for the samples returned, we have identified confirmed cases, and there are some symptoms who show no symptoms. That's why the Department of Health colleagues need to look further into these cases. Mr. Chen? Yes, Howard, please. Well, as the Secretary explained at the Executive Council meeting today, the agreement was given to amend file regulations 599C, E, F, and G. For 599C and E, they have to do with arrivals from the mainland and foreign places. It's about the quarantine arrangement. Now, for these 4 regulations, they will expire on different dates in June, so there's a need to decide whether to extend these regulations. Now, as the epidemic has been going on for some time, so the government decided to extend these 4 regulations. For 599C, it will be extended by 1 month to early July. 599E, well, the epidemic around the world is still not stabilized, so that's why it's decided to extend 599E by 3 months to the 18th of September. For 599F and G, the Executive Council agreed to extend these 2 regulations to the 31st of August. For 599F and G, the regulations will remain in force until the 31st of August. But then it does not mean that the directions of the Secretary for Food and Health will also be valid for the same period. During the validity of the regulations, the Secretary for Food and Health may issue directions to different business premises or eating establishments, so they have to comply with certain conditions in operating their business. As for 599G, is about gathering restrictions. The secretary could issue directions for 14 days each time of a shorter period. Now, the existing directions will expire on the 4th of June, so the secretary has now issued a new direction under 599F and G to extend validity to the 18th of June, and then we'll decide what to do after that. Thank you. The lady in white on the third row. I'm from Cable News. First question about Lake Yuen Estate. Are there any preliminary confirmed cases today? If so, on which floors do the patients live? And have you identified the source of infection? And have you found out what facilities they've shared? Now, there are confirmed patients living on the 7th and the 8th floor, but actually the letterboxes of these two floors are not on the same side, and they don't share any common facilities except for the entrance door. So do you have any ideas about the source of infection? What is your initial guess? What have they touched leading to the infection? Now, experts have suggested that these residents should be put under medical surveillance for 14 days, and you're just testing the whole block. Is that enough? The housing department has already disinfected the common areas nearby. Does it mean that you have actually destroyed the evidence, so it will be harder for you to trace the source of infection? Second question is about the gathering restrictions. Now, usually it's just for 14 days. How come this time the ban is for 2 months? And why is it not not early August? Why is it the 31st of August? Even if you extend it, so maybe the public will think there are political reasons. Do you think that's possible? And then thirdly, now there will be the June 4th activity. Would Dr. Chuang recommend people to take part in those activities? Now, Dr. Chuang will first answer your questions on Lake Yuen Estate and the other questions you've asked. It's a question of the lift serving odd and even floors, right? Now, we've asked the patients, well, it doesn't matter whether they live on the 8th floor or on higher floors, because on the 3rd floor, there is a footbridge that links that block to the market. So people often would like to take the staircase to go down, and then going up they would take the lift. And sometimes even if they live on the even floor, they take the lift for the off floor to go one floor up and then walk down one flight of steps. And then there may also be handrails that they may share, and then they may have touched that. But every time when there's a confirmed case, the first thing to do is to disinfect the area. Now, of course, with epidemiological studies, it's important we identify trace the source of infection, but more importantly, we need to protect the people. So if we think that patients have touched certain things, we must do disinfection at the first instance. We can't wait till samples are taken, so other people won't get in touch with contaminated areas. It's not about destroying evidence. And even if we do not manage to collect the evidence or samples, then we will have some idea of what the environmental contamination may be. Maybe certain patients don't observe personal hygiene. They touch something and don't wash their hands. We know these are known source of infection, known chain of transmission. Now, for gatherings, unless they're absolutely necessary, it doesn't matter if it's a meal gathering or other gatherings, please avoid them as far as possible.
Let me once again explain the group gathering ban. That's 599G and 599F. This is a public health emergency regulation, 599 C, E, F, and G. These are emergency regulations, and there is a validity period. So when we first enacted these regulations, they were for a period of 3 months. 599G, the validity period will be 28th of June. G 599G is 27th of June. And we have to consider later how much longer this is going to be extended. By the end of June, this will lapse. So we have to consider extending the regulation so that when directions, the 14-day directions have to be issued by the Secretary. That is the directives regarding the different premises. Like people have to wear keep the face mask on if they're not eating, and temperature screening, and the distance of 1.5 meters. All these are conditions and directions, and the longest period would be for 14 days. So with all these directions, they would be for a period of either 7 days or 14 days. And before the 14 days are up, we would consider whether they should be relaxed or whether they should be tightened up. So for these eatery premises and other premises, the validity period would be for 14 days. So for the 8 people group gathering and so on, we will be issuing a press release to put things beyond doubt. This is 14 days. As Mr. Chen said, the validity period for group gathering, it expires from on the 28th of June. It will be until the 31st of August. And for 599G, it will be extended to 31st of August. So it's not a question of the direction lasting for 2 months. The speaker's not coming through. Dr. Chuang, we don't have any preliminary confirmed cases. We have collected samples from the residents. Even if they've tested negative, they should pay attention to their own health. The same can be said about other residents. If they develop even minor symptoms, they should seek medical attention. Gentleman in checkered shirt in the 4th row. Apple Daily. Now for Luk Chun House, some of the confirmed patient went to the markets and will be distributing the bottles. Are there any other residents in different blocks that have been infected, although you haven't distributed the bottles there? Are you going to cover the entire housing estate to make sure that the patients will be picked up? Now, for these 4 new cases in Luk Chun House, what floors are they living in? How far are they from the infected married couple? Now, there is a paramedic who was infected. On Saturday morning, he was exposed to the patient. How long did it take before he was isolated? Also, a question for the secretary. For the group gathering ban, there are certain activities that there would be a necessity, like eating meals. For swimming pools, beaches, and karaoke lounges, how essential are these facilities? Now, you're not allowing people to have freedom to stage a rally. Are you truly considering the matter from the proper health point of view instead of having any political suppression? Dr. Chuang? I think we have to limit ourselves to certain scope, and we cover the areas that the patients have been to. Now, for the blocks that they have never been to, the chances of infection would be like anybody else in Sha Tin. We may have covered these blocks, and there may be residents nearby. Hong Kong is, after all, a very small place. I think everybody has to pay attention to their own state of health. If they develop any discomfort or any ill health, they should go to the doctor as matter of urgency. Now, for the paramedic, I didn't realize he was a confirmed case, there's 1084. Now, he went to the hospital straight away, together with a number of colleagues. He reported this to his senior. As soon as we became aware of this confirmed case, 1084, he was already in hospital and he has been isolated. Thank you very much for your question. Let me try and explain the public health consideration once again. For this group gathering ban, now we need this because we would like to stop people gathering. The overriding consideration of this is public health because we want to minimize infection. The people may stand a higher chance of being infected in a large group, and there is a likelihood of an outbreak. And that's the overriding consideration. You mentioned a moment ago the rallies and protests. These are also mass gatherings. There are many mass gatherings under 599G, and they cannot happen, like a soccer match and any other mass gatherings. Under the existing ordinance, we do not suggest that this should happen. Like Dr. Chuang said, there are certain things that are essential. Even if they are essential from the public health point of view, we like to minimize these activities as much as possible. We do not, of course, recommend any mass gatherings, in particular, given the fact that we have seen a potential chain of transmission, and there are silent cases. And like this particular case in Lake Yun Estate, we have a mini cluster of infection. That's why we are extra doubly concerned about the situation. So, as you mentioned a moment ago, karaoke, why do we allow them to open? I think we have to look at the premises. If you look at 599F, they're basically food establishments and other premises. And we are relaxing the restriction in an orderly manner. We do not open them up all in one go. So we have to proceed in an orderly fashion. Even so, we apply different conditions. Like we have to make it mandatory for people to keep the face mask on with limited number, and we also issue other directions to make sure that the public health risks would be minimized. For the 599F and 599G, we will keep them under constant review. They are not there for the long haul. So in terms of the pandemic, in terms of the way of transmission, in terms of the situation in the community, and also our ability to conduct tests, we would take into account all of these factors. The speaker is not speaking through. At the moment, we do not have a sequence like 1, 2, 3, 4, 5. I think we have to consider to what extent the relaxation should happen, like school resumption, and that's essential. The Education Bureau has already started to open up the schools from secondary schools all the way down. That's the orderly fashion that I refer to. The lady over there in gray in the middle, please.
I'm from Singtao. Now, Professor Yun said that the source of infection could have been the letterboxes or the door handles. Did you check the CCTV? Were they there at more or less the same time? Otherwise, how could you, assume that these facilities could be the source of infection? And if so, would you ask residents who were there at around that time, say to collect letters and so on, to return the samples, because you said some have not yet returned the samples? And what is the CT value of the confirmed cases? Was it higher or lower? Because we want to know if they had the disease earlier than the others. Now, if some experts said that for people living in that block, or maybe they shouldn't go to work or school for 14 days because one test may not be enough. Would you arrange 2 tests? There are 6 confirmed patients in the same block now. Would you perhaps recommend that they don't take part in high-risk activities like singing and karaoke? Now, for the 6 confirmed cases, you said that they've all been to supermarkets or whatever. Is it possible that they were infected in a supermarket? And another question is on testing figures. Now, for high-risk groups, the rate of return of the specimen bottle is only 40%. So how can you encourage people to return, more people to return the bottles? How come so few are returning the bottles? What's your assessment? And then you have said that you would like to encourage more people to do the tests. So what are you going to do? More community surveillance? Do you have plans? Now, we have no plans to check CCTV footage to see whether they were there at around the same time, because for environmental contamination, there's no need for them to be there around the same time, because the virus may be there for some time. So more importantly, is about frequent cleaning. And if you have touched any public places, you should wash your hands as soon as possible. It's not a question of, it's not necessary that you have to be there around the same time. As for letter boxes, door handles, handrails, and so on, these are all facilities people might have touched. That's why it's important to observe personal hygiene. In any case, these are all just hypothetical assumptions. Maybe they live in the same block, even though they're on different floors. Maybe they have touched same public facilities. So these are the only links we could identify for now, because they don't know each other well, and it's not like they chat with each other often and so on. They don't even know each other, actually. It's just that in the same environment, around the same time, we have identified these cases. And so our assumption is that probably is to do with some common facilities. As for supermarkets, we are going to distribute specimen bottles to the staff, so we'll see how the testing results turn out, because these people have stayed at the supermarket for a relatively longer period. And of course, then these places may be high risk. Now, for all residents, especially those in high-risk groups, that is, the people who come in contact with more people, then they really must watch their own health condition. And if they have any mild symptoms, they must see a doctor as soon as possible. And then they could also ask the doctor for a test, because the test is free, really. From the Department of Health, it's easy to take the test, so we hope they just to do the test. Sorry, the speaker's not coming through. We'll contact the persons in charge at the supermarkets. They will tell us how many staff members they have, then to give them so many number of bottles. As to whether there is need for a second test, we'll look at the test results first. Now, for the 4 patients, now 2 are asymptomatic, but after they go into hospital, actually they started to have a fever. So it's a matter of, observing your own health condition. Now, the first test result might be negative. Maybe we don't have to wait till we give people a second sample bottle. Instead, people should watch their health condition. If they start to have a fever, if they start to feel unwell, they should see a doctor and ask for a test. That would be the better way to do it. Okay, going back to the question on tests. In our whole prevention and control effort, testing is an important element. Now, for people who have symptoms who are admitted to hospitals, there are confirmed cases, and then there are also people with mild symptoms or even no symptoms, and we found such cases among the confirmed patient cases. So the government, of course, has the duty to expand our surveillance scope so we can do more tests, and we are actually doing that. Now, with the existing testing capacity, we need to expand that further. And you might recall we mentioned this too before. We have made use of the anti-epidemic fund to give more resources to the Hong Kong University and the Chinese University, as well as the public health laboratories, so that they could buy more equipment and hire more staff to expand the testing capacities. Each day, therefore, we could test a total of 7,000 samples. We hope that this will happen as soon as possible. With the current testing capacities, how do we make full use of that capacity? Well, as Dr. Chuang said, maybe we need to accord priorities. Maybe we have found now people who only show mild symptoms, or maybe there are other people who are considered high risk because they come into contact with many people. Then we would like to test these groups first. For example, in this case, residents nearby and all other high-risk groups that we mentioned before. So we are going to give priority to these groups. Now, for our testing capacity, since the start of the epidemic, we've expanded the scope of testing by 8 tiers. That is, now we have testing from tiers 1 to 8. Some tiers have to do with hospitals, others have to do with the community. For example, general outpatient clinic, private clinics. Here we're talking about patients with symptoms in the community. And then there are also people in the community without symptoms. For example, for all arrivals at the airport, they have to be tested. And then we further expand our testing scope to cover workers at the homes for the elderly and the disabled, the traditional Chinese medicine clinics, the Kwai Ching District Health Center, and so on and so on. So these are high-risk groups with, who are not showing any symptoms. So our scope of surveillance is extensive. But then you ask a very good question. You ask how comes the return rate is not so high in some cases. Now, I think we have to look at the health promotion model. How people behave in relation to health, when would they do something or not do something. Well, it's a question of whether the person is a question of susceptibility of the disease. That is whether the person thinks he or she may get the disease. If the person understands the risk and thinks that there's a high chance of the person contracting the disease, and of course he or she will go for the test. And we have to ask for your help. The media could help us publicize the message. So everyone knows that actually the risk does exist. So if you're given a specimen bottle, you should give a specimen and return it to the Center for Health Protection as soon as possible, so a test can be done. And then private doctors must understand they also have a duty. That is, if a patient comes to the doctor and the patient exhibits mild symptoms, then a specimen bottle should be given to the patient for a test to be done. So we hope the whole community would join hands to fight this epidemic. And then we must make the public realize the importance of testing. Now, at different locations, we're giving out the specimen bottles. So we're giving people a chance to get tested, and I hope they will seize upon the opportunity. Thank you. Sorry, speaker's not coming through. I think Dr. Chuang could respond. I don't think there is a distinction between the elderly and non-elderly, because many residents in Lake United are really concerned. Now, if people have mild symptoms, they must go to a doctor as soon as possible and get a test.
Speaker inaudible. There are 4 or 5 that are related. The other 2 had onset earlier. It's all a matter of how you define super spreader. If this is a source, then many people have been exposed to her. speaker's not audible. Well, 14 days. Well, Professor Yun has already explained the situation yesterday. We will look at the testing results and make a decision. I understand the Sha-Tin depot is very concerned that there are 100 or so people, ambulancemen, we have distributed bottles to them. Therefore, the 100 ambulancemen, we have distributed them the bottles for testing. Didn't I say that? For the Huiqing DHC, it has just started. It is a membership center. According to my information, they haven't distributed any bottles, but if they are members, like I said, if they belong to the high-risk group, they can get a bottle from the center. For the 18 Chinese medicine centers, they have, I think, distributed about 200 bottles. Thank you all very much.